It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode, I answered another question from one of my clients, and the question in last week's episode was how to get your loved one into neurology rehabilitation after a stroke and intensive care. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to continue answering the next questions regarding James and Christine's dad in ICU who's had a hemorrhagic stroke. James's and Christine's dad had a brain decompression where they evacuated a large bleed from his brain after the hemorrhagic stroke. Their dad also underwent a craniectomy, which is basically a partial removal of the skull, to decrease the brain pressures after the bleed. James and his sister Christine were getting their dad in one of the best hospitals in the United States, the Cleveland Clinic in Ohio. In the meantime, their dad was getting a tracheostomy because he couldn't be weaned off the ventilator and the breathing tube. He also had a PEG tube for feeding inserted. He also had ongoing seizures due to the stroke, and his anti-seizure medications needed to be optimized so he could wake up and progress to neurology rehabilitation. Since last week's one-on-one consulting and advocacy session, James and Christine's dad has been off the ventilator and has been moved from intensive care to a step-down unit. Their dad still has the tracheostomy in place, but is off ventilation and breathing by himself for now. He's still having occasional seizures, and the doctors and nurses are still trying to optimize the seizure medications. In today's episode of Your Questions Answered, I answer a series of questions again from James and his sister Christine, and they are excerpts from various one-on-one phone and email consulting and advocacy sessions with me. The topic this week as part of this one-on-one consulting and advocacy sessions is how physical therapy will help your loved one to get off the ventilator and tracheostomy. You can also watch or read previous episodes of this series of one-on-one consulting and advocacy sessions with James and Christine's sister and his sister Christine by clicking on the links below this video. And if you are watching this on YouTube, just click on the link below this video and it'll get you to our website where you can access all the other episodes as well as this episode from today. So, James asks, "Hi Patrick, my dad's making progress and he's now having time off the ventilator during the day. What exercises should the physiotherapist be doing with my dad while they are weaning him off the ventilator? Do you have any videos? Thanks from James." And here is my response. "Hi James, unfortunately I have no videos for exercises. For now, the physiotherapist or physical therapist should be doing the following. They should be getting your dad out of bed twice a day, once in the morning and once in the afternoon, with a break around lunchtime for a rest. They should be sitting him on the edge of the bed and see if he can maintain strength in his upper body. Sitting him out of bed, if he can, in a recliner chair. Doing breathing exercises with a goal to strengthen respiratory or breathing muscles. They should also be doing coughing exercises And again, the physiotherapist should be doing that if your dad can cooperate. If your dad can't cooperate with coughing exercises, they may be using a device called Cough Assist to again strengthen respiratory, breathing and coughing muscles and also to clear his cough. Coughing will be essential to eventually also have the tracheostomy removed after he can stay off the ventilator. They should also continue to move arms, legs to maintain movement, prevent contractions and build up muscle tone. You and your sister can move his arms and legs too. Any movement and stimulation will be good as long as he can stay free of seizures. Also, the physiotherapist should potentially try and stand your dad up with the help of 1, 2, or maybe even 3 people, depending how and if he can manage. And then, if he can stand, next they can also try to march on the spot. I hope this makes sense, James and Christine. Any questions, please let me know. So James writes back, "Thanks, Patrick. We are really perplexed on what to do with him, where to move him next, etc. We are glad he's making steady progress. The ICU is not doing any of these things for him that you described. At best, they put him in a chair once a day and that's it. Seems as though step down or LTAC is a bad choice. What are your thoughts?" Hi, James. As I have said many times before, any ICU is much better equipped and skilled to wean a patient off the ventilator and the tracheostomy than any other area, let alone LTAC or long-term acute care. The only other place that can wean a patient off the ventilator is intensive care at home services, and you can check that out at intensivecareathome.com. It is very disappointing to hear that they are not going to do any of the things that I just mentioned, given you are in one of the best hospitals in the United States. It sounds to me like they are in the very early stages of weaning him, and given that they probably started weaning him on a weekend, I hope this will gain more speed starting Monday with more resources and staff normally becoming available. I do believe there is a tendency in the United States to use a tracheostomy as an excuse to move patients on to LTAC or long-term acute care, rather than taking measured steps to wean patients off the ventilator whilst they are still in ICU. Bear in mind that in ICU you have the full expertise of critical care and intensive care doctors, intensive care nurses, respiratory therapists, as well as physical therapists, etc. Without that level of expertise that is required to wean a patient off the ventilator, LTAC has the potential to set back your dad. Here at intensivecarehotline.com, we get far too many inquiries in regards to families wanting their loved ones out of LTAC because they think it's disastrous and not what they expected at all. Families often think that LTACs don't wean aggressively enough, and they often think they deliberately keep patients on ventilation and tracheostomy to keep their beds occupied and maximize their revenue. I do believe there are some shocking practices out there. The reality is that step down as well as LTAC won't provide the same level of care, skills and expertise compared to ICU. If he was well enough, then step down would be good, but it doesn't sound to me like he's ready yet. Have they given you timelines for moving him to LTAC or step down? Here is James' response. Hi Patrick, I had the opportunity to tour the LTACs today in Cleveland. I was not impressed at all. In fact, I was getting even more worried for my dad. We are going to ask Cleveland Clinic if my dad can stay in the ICU, but they may say we need to leave due to insurance, etc. Do you know what we can say or the reasons to justify for keeping my dad in the ICU as long as possible and then going to the neuro step down in the hospital? We toured that floor today at the hospital and it was far better than LTAC. Thank you, from James. Hi James, I have spoken to your sister in regards to this issue. We have been speaking about how to potentially avoid LTAC and keeping him in hospital in the ICU for as long as possible so that they can focus on weaning him off the ventilator and the tracheostomy. Once that's been achieved, then the next steps could be neurology rehabilitation. It's very good that there are no timelines yet. Once they start introducing timelines around when to leave hospitals, you may have to speak to insurances to find out about what they are prepared to fund. Now, before I go into James's response, if you have watched this far, you may want to get one-on-one consulting and advocacy with me as well. If you do, just click on the links on the top of the website where you can see the consulting and advocacy sessions, and you can choose from the option that works best for you. So here's what James says. Hi Patrick, I think I may have little good news. My father has been up in a chair, breathing with a tracheostomy collar most of yesterday and today. He was in the chair for 5 hours and on the tracheostomy collar for 10 to 11 hours in total. The speech therapist came in today and put in a speaking valve. They deflated the balloon and discussed using ice chips with dye tomorrow. Physical therapist seems to really get him moving today around 12:30, especially when they sat him up straight in the chair. By the end of the day, he was actually fighting with my sister to try to take the helmet off his head. I think it was too hot. It's not safe to even take the mittens off at the moment. They bumped up his dose of Keppra today by 250 milligrams because he had a mild seizure early Monday morning. I am wondering if that could be from the tracheostomy collar. It would be great to hear my father speak a few words at this point. Please email back with your thoughts and guidance on the above, from James. Hi James, that is fantastic news and great progress. Seizures are unlikely from the tracheostomy collar, but it can't be ruled out either. The seizures are probably more of a combination from stimulation through mobilization. At this stage, keeping him seizure-free is very important to not jeopardize any recovery. Hence, if they think increasing Keppra is keeping him seizure-free, then I would support the increase in Keppra. It is very encouraging to hear the speech therapist is giving him ice chips. If the tracheostomy cuff comes down, he might be closer to speaking, but don't be discouraged if he doesn't talk straight away. One step at a time. Just by what you are describing, it sounds like he's made a lot of progress just within a few days. We'll talk soon. Here is what James writes back. He says, Hi Patrick, my father had another very interesting day. They said his blood pressure was low this morning and his white blood cell count is a little over 11. So for some reason they put an IV in his neck to deliver antibiotics in anticipation of an infection. I don't know why or how, but he became irate. He kept trying to bite his mittens and to take it off with his teeth. It was moving his lips and seems like he was trying to yell at everybody. They did also put an arterial line in today. He seems to be breathing with no problem on the tracheostomy collar. We got a few words out of him with a speaking tube. However, he's still not responding to commands, but is very active nonetheless. Keppra is at 3,500 and Dilantin is at 300. I have been fighting tooth and nail to keep them in this hospital. I'm not moving to the LTAC. It's been kind of ridiculous. Please email me back with your thoughts on all of the above. I also feel like my father is aware and can understand, but is just not able to get the words out. Sometimes he drifts in and out. The doctors mentioned that he may be depressed from the brain injury, and he suggested Zoloft or sertraline. Many thanks from James. Hi James, if his blood pressure is low, this could be a sign of an infection indeed. The white cell count at 11 is slightly elevated, the normal range is 4.3 to 10.8, and it may well be the beginning of an infection, but I think it might be slightly premature to treat with antibiotics and putting in an IV, unless they have done more testing and they have already found the source of the infection. Also, do you know if your dad has a temperature? Have they done any other screening for the infection? For example, taken blood cultures, done a chest x-ray? Have they done swabs from catheter, urine, or any other IVs, or the PEG site? This could all be potential sources for the infection. It's definitely great to hear your dad is breathing fine on the tracheostomy collar. Has he been back on the ventilator at all in the last 24 to 48 hours? It's also good to hear your dad is trying to mouth words or even yell, even though that could be a sign of frustration indeed, and it could be a sign of depression, but I come to that in a moment. Are you also saying his dad has mittens on his hands to stop him pulling things? Also, if your dad's blood pressure is low, have they started him back on inotropes or vasopressors such as norepinephrine or epinephrine? On the one hand, I don't like they put back in the arterial line. However, as long as he has an arterial line, you won't be going to LTAC. The arterial line to me is a sign they most likely have started him back on inotropes or vasopressors such as norepinephrine or epinephrine, and you may want to find out. If you think your dad is aware of what's going on and can't talk, it could simply be that the speech area of the brain is affected from the stroke, a question you may ask the neurologist. The Keppra dose is still very high, but if it's needed to keep him seizure-free, so be it for now. Your dad is on a long road to recovery, and it looks like he will get out of ICU alive. That was and still is your first goal, even though there are setbacks with a potential infection. Being off the ventilator is a very good sign, and continue to avoid the LTAC if you can. Arterial line and potentially inotropes and vasopressors means no LTAC for now. Being off the ventilator also diminishes the likelihood of LTAC. A depression might be a reality for your dad if you think he's depressed too. They may start him on some antidepressants we should probably discuss in more detail over the phone. Many thanks from Patrick. So that's it for today. And how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind the scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I will see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. Or you can call me. Find international phone numbers on the top of the website, and also have a look at our ebook section. And you can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.